pressure should be the same. And if there's any fluid collecting behind the eardrum, it can drain out, just like what's going on here. So in a silly kind of way, the grommet is actually functioning here. So when your eustachian tube is blocked, there's no air behind the eardrum, so the eardrum gets pulled in. I should have perhaps explained this. So the eardrum gets pulled inwards. It's a vacuum, similar to when you're on an aeroplane. When you're descending on the airplane, the air pressure in the cabin is greater than the air pressure behind the eardrum. And if it's a sudden descent, before your eustachian tube can equalise it, as you're descending on a plane, the air pressure pushes the eardrum inwards, it buckles inwards, and we feel blocked. And we perform the Valsalva. We close our mouth, pinch our nose, we blow into our nose, it forces air up the nose, up the eustachian tube, even if it's blocked, or as a little bit of air even, and it then helps to pop the eardrum back out and we can hear again. But when your eustachian tube is blocked, you're not able to do that. So the grommet is a short-term, generally a short-term fix. The idea is like a grommet should be in the ear for around 6 to 12 months, and by the time it falls out, and it normally falls out by itself and it comes out of the ear by itself, whatever the underlying issue is with the eustachian tube, we're hoping that it self-resolves. Now, my auntie is quite fortunate in some ways because her grommet hasn't fallen out and it doesn't look like it's going to fall out, not in the near future anyway. So she's had it for 5-6 years now. And this is the first time she's had an infection. Now, I cleared as much discharge as I could, and then I just rang my colleague, Mr. Darius Rajali, who I've got utmost respect for. He's an amazing ENT surgeon. He's my mentor. I've worked with him for a number of years. And I explained the situation, and Mr. Rajali was in part in agreement with me. He felt the best treatment for my auntie would be topical ciprofloxacin eye drops, which are non-ototoxic, and we'll try and get it through the grommet. It would probably be more effective. There is a possibility that this infection is not going to clear, and my auntie then may need to see Mr. Rajali, and there may be the need to remove the grommet. Now, although a grommet's in a way at the moment doing its job, it's allowing the fluid behind the eardrum to drain. There is also a counter argument that the grommet caused this infection. When you've got an opening in the ear canal, you can get bacteria entering through the ear canal, through the grommet into the middle ear. Also, water precautions. Now, my auntie is very, very careful. She did mention she possibly may have got some water in as well. And if you've got water in to the ear and it goes to the grommet, enters the middle ear, leads to an infection. So grommets can, although it helps to an infection resolve, if you've developed one by allowing fluid to drain out, inadvertently it can also be the cause of an infection. So what the plan was whilst my auntie was here, we wanted to get as much fluid out behind the middle ear as possible. And what you're seeing here my auntie do is eject the fluid from the back of her nose. So she was using an otovent nasal balloon. The otovent nasal balloon is when you inflate the balloon using your nose. It comes with a nasal capsule, and you attach the balloon on one end. The opposite end, it's like a rounded tip with a hole, and you position that, in the case of my auntie, at the entrance of your left nostril. You pinch your right nostril shut. If you're doing it up the left nostril, you close your mouth and you blow into the balloon using your nose. And as you're inflating the balloon using your nose, when it's the size of like an orange, for example, you swallow, and it forces air up the nose, up the eustachian tube, and in this case, what we're trying to do is push, almost flush, all the infected fluid behind